I want to welcome everybody to our workshop today called Why Isn't My Brain Working? I'm Dr. Michael Taggart with the Kirkland Health Institute, and I'm a member of the National Foundation of Wellness Professionals, which is a group of doctors who go out in the community and share important information about health and wellness. I've been in private practice for over 25 years. I'm a doctor of chiropractic. In addition to that training, I'm trained in functional medicine and something called functional neurology, which you're going to learn about in a few minutes. Only 1% of the profession has this kind of training. I have advanced training in blood chemistry analysis, neurotransmitter functional analysis, clinical nutrition. The focus of my practice is helping people overcome chronic health conditions. And I do that by combining specific neurological testing and treatment along with metabolic or laboratory tests to find the root cause of chronic health conditions. There's a great website that I want to make you aware of called lifechangingcare.com. On this website, there's over 2,000 testimonials of maybe some people like you who had chronic health conditions, weren't able to find the answers, the doctors to help them. Luckily, they didn't give up. They kept searching. They found the doctor who had the expertise to help them. There are testimonials on there. Many of my testimonials are on the site as well. There's also a nice video that you can watch. It gives you more information about what we do. If you know people who are maybe out of state, there's a referral network where you can find somebody who has the same kind of training that I do. I'm also the author of this book called Healing Your Thyroid Disorder Naturally, End the Frustration and Learn What Your Doctor Doesn't Know. You're going to learn a little bit more about why the thyroid is so important for brain health. One of the things that thyroid hormone does is it brings oxygen to your cells, especially your brain. It's available on Amazon, and you can also get it from us in the back. Okay, here's what we're going to be talking about today. We're going to talk about how the brain works, underlying causes of brain decline, common symptoms that are brain-related, what can be done to maximize your overall health and your brain's health through functional medicine, it's basically nutritional therapy, and functional neurology, and also lifestyle change. So that's some pretty important information. If you want more information on some of the things that we're going to talk about as far as background information, this is a great book. This is why I named the lecture after the title, Why Isn't My Brain Working, by Dr. Tadis Karazian. He's one of my mentors. A really good book. It's a bit thick, but it's really good. Now let's talk about different kinds of brain issues. In the brain, there are what we call hard lesions and soft lesions. A hard lesion would be something that would show up on an image like an MRI or a CAT scan. It's like a tumor, a pathology. It could show capillary damage because of a stroke. There would be very obvious exam findings like you can't move your arm, things like that. This is going to be best handled by a medical neurologist. Now there's a soft lesion. That's going to be different. That's not usually going to show up on an MRI. The exam findings are going to be there, but it's going to be more subtle. It's a functional loss. It's not a pathology, but it's a loss of function. And this is going to be best by someone like myself who's trained in what we call functional neurology. And I'm going to do a demonstration of that here a little bit later. I think you're going to find it very interesting. So here's some symptoms of soft brain lesions. Okay, depression, anxiety, insomnia, fatigue, memory loss, brain fog, pain, headaches, trouble with focus, attention deficit, may have issues with feeling over-emotional, maybe feel like you're impulsive, vertigo, blurred vision, balance problems, movement disorders, can't follow directions, get lost easily, high blood pressure, OCD, mood swings, lack of motivation. It's a lot of things, and there's probably more as well. Now, how prevalent are soft brain lesions? Well, we know that about 20% of seniors can develop Alzheimer's, and at the end stages it does show up on an MRI, but in the beginning stages it does not, even though there's a loss of function. About 20% of children will have some type of ADD, autism spectrum symptoms. Dementia, in our country about 24 million Americans have dementia. That's expected to double by 2040. The use of mind-altering drugs like antidepressants, anti-anxieties, that's chronically, it's epidemic proportions of those kind of drugs that are used. Does anyone know what the most common cause of accidental death is? Medications? Okay, that's a good guess. This is as far as accidental. So if you take a medication, it's not an accident. That's okay, it was a good guess. Accidental, yes, exactly, falls. Falls, because people have poor balance, okay? And if you're a senior and you fall, what could happen? Hip, and then if you get a broken hip, that could be the end, right? So not good. Yeah, in fact, yeah, it's the leading cause of preventable death in seniors is falls. Okay, let's talk about what you need for a healthy brain. Some big picture things that you need. You need proper fuel supply to your brain. That's going to be in form of glucose, the food that you digest, okay? It's going to be oxygen. You need fuel, oxygen and glucose. You also need proper neurotransmitter function. We're going to talk about what neurotransmitters do in a few minutes. And also you need to have activation in your brain. That's using your cognitive function, and also getting physical activity also activates the brain. So you got to have both of those things going on. You probably heard the term, if you don't use it, you'll lose it. It kind of applies here. Now, if you don't have these basics, even if you're taking medication, it's not going to work in the long run, because this is the foundation of brain function. Taking medications is not going to change this. So let's talk about metabolism. What's metabolism? It's a word that a lot of people use, but what does it mean? It means eating something, your body breaks it down through the digestive system, and it becomes something that's usable, that your body's going to use for energy, cell repair, and growth. That's what metabolism is. If we have metabolic problems, we're going to have decreased energy production and decreased energy overall. Now, what organ consumes the most energy by far? Take a wild guess. The brain, yeah, very good. Yes, the brain is going to consume 30% of all of your fuel supply, which is going to be in the form of glucose and oxygen. Now, there are different lobes of the brain. We're going to talk about each of the lobes of the brain, and they have different functions. They all kind of work together, but they have specific functions. The frontal lobe, it's the biggest. It's right in the front here, hence frontal lobe. It's going to be involved with executive function. You think of an executive, a CEO. CEOs have to look at the big picture of what's going on. Executive function is the ability to detect a problem and step-by-step tasks to solve the problem and to see it through its completion. A lot of people have trouble with the follow-through. So that's one of the things that the frontal lobe does. It's also involved with social behavior and impulse control. We've all probably had a situation in which we got so mad at someone we thought, I would really like to punch this person in the nose, right? We all have that maybe urge at some point, but our frontal lobe says, you can't do that, because if you do that, they might hit you back harder and cause more damage. They might call the police and you might get sued. So the frontal lobe is your impulse. You have this like immediate reaction, your frontal lobe says, oh, you can't do that, it's going to be bad news. So people who have issues with inappropriate social behavior, that can be a frontal lobe issue. It's also involved with focus. It's also involved with motor movement. Okay, anything that you do with moving your body is a frontal lobe issue. Depression is defined medically as frontal lobe fatigue, decreased firing of the frontal lobe. So here's some symptoms of frontal lobe degeneration. Okay, depression, anxiety, slow movement, mental sluggishness, inability to focus, poor handwriting, poor cognitive function as far as like with language or math. That's typically a left brain activity. Let's talk about the next lobe. That's the temporal lobe. It's on the side here. It's going to be involved with hearing, smell, taste. It's also involved with interpreting sounds. And there's a part of the frontal lobe called the hippocampus. Raise your hand if you've heard the word hippocampus. Okay, a lot of people have heard of it. That's great. It's going to be involved with language and memory. It's also involved with hormonal regulation along with the pituitary gland. It's involved with your sleep and wake cycle. That's called circadian rhythm. So it helps modulate that. Alzheimer's disease is a degeneration of the hippocampus. So when we have temporal lobe problems, obviously we're going to have issues with memory, hearing difficulties. You might have tinnitus, involved with sleep, so insomnia. Also abnormal shifts of fatigue during the day for no reason, and that's going to be involved with dementia. The next lobe is the parietal lobe. It's also on the side. It's a big lobe here. It's involved with all processing your sensory environment. So it's going to modulate feeling pain. Also, it's involved with where's my body in space. So those receptors and the skin, muscles, and joints are all going to go up into the parietal lobe, and the parietal lobe is going to calibrate that and give your nervous system information that it needs to be involved with balance and other things. This diagram here is called the homunculus. How many have heard of the homunculus? You ever heard that term before? Okay, homunculus. Okay, good over there. Homunculus in Latin means little man. Now, what you see in this diagram here is that different body parts relate to different parts of the brain. And can you see by this, based on this diagram, that, like, for instance, the face, the eyes, the hands, and the feet, the proportions are inappropriate. They're exaggerated in different areas, right? So what this diagram is showing is that different body parts have a very high amount of neurons in the brain to control that activity. So when we do our neurological therapies, these are the areas that we do a lot of therapies for, because we know that if we do that, it's going to have a big impact on the brain and the nervous system. So some symptoms of parietal lobe degeneration. You feel unstable in the dark. You feel unsteady on uneven surfaces. You may misjudge things, which makes you injury prone. You should be able to recognize certain objects by just touching them without seeing them. People with parietal lobe issues have trouble with that. You may get lost easily. You may have numbness, tingling, pain in strange parts of the body, or everything is on the same side of the body. Occipital lobe, that's your back here. It's involved with visual processing, processing visual information like shapes, colors, movement. It can be involved with hallucinations. The cerebellum is the very back part of the brain, and it's the oldest part of the brain, and that's one of the areas that we work a lot with our brain-based therapies. And what the cerebellum does is it coordinates muscle activity. Do you remember when you were a kid and you had to learn how to ride a bike? That was hard, right? When you kept falling. I remember, I still have memories of that, of struggling to be able to ride the bike because I wanted to ride that bike so badly. Just like you, I persevered and I kept doing it, and all of a sudden I could do it. And then I could go 2, 3, 10 years without riding a bike, and I just get on and I can just ride, and you probably can too. Because our brain, with our cerebellum, figured out how to work the muscles so that you could balance riding a bike. And that memory, as long as your brain's healthy, is always going to be there. So that's what the cerebellum does. It's also involved with eye movements, very much involved with balance. So it's an area that we work a lot with our brain-based therapies. Here's some symptoms of cerebellar degeneration: dizziness, vertigo, blurred vision. You might get nausea from visual inputs. Your balance might be poor. You might feel like you're clumsy. You may get a subtle shake at an end range of movement. One of the tests we do is called the finger to nose test, and people might get real close and they might start shaking. That's a sign of a cerebellar weakness. Also, it's going to be involved with chronic neck and back pain, because one of the jobs of the cerebellum is the tone to the big muscles that support the spine. Cerebellum, very important. Now we're going to talk about the last area of the brain is the brainstem. It's also known as the autonomic nervous system. Autonomic means automatic. It stimulates your organs, blood vessels, and glands, and you don't have to think about that, right? It just normally happens. Now, the autonomic nervous system can be broken down into 2 different areas: the parasympathetic and the sympathetic system. The parasympathetic is also known as the rest and digest part of the nervous system. It's the lower brainstem. So it's going to be dominant with sleep and digestion. Then there's the other side, which is your sympathetic nervous system. That's called fight or flight. How many have heard of fight or flight? Okay, that's the upper brainstem. Now these 2 divisions cannot dominate physiology at the same time. One is always going to be enhanced, and the other one's going to be dampened. So when you're under stress, guess which one is going to be dominant? Right, sympathetic, exactly. Now when we talk about stress, there's lots of different kinds of stress, not just emotional. Now 90% of the brain, the cortex, not so much the cerebellum, but the cortex, the different lobes, the frontal lobe, the parietal, and the temporal lobe, is designed to stimulate your parasympathetic nervous system, which drives all of your organs. And so if we get decline in brain degeneration, what happens is that parasympathetic organ function is diminished, and you get stuck in the fight or flight response. It takes over. Here's some symptoms of having too high sympathetic activity: high blood pressure, dry eyes, may have losing taste and smell, poor digestion, where those nerves go to the digestive system and all the organs, headaches, chronic pain, insomnia, fatigue, hormonal imbalances through cortisol, which is a hormone that your adrenal gland makes. We'll talk about in a minute. You may have issues with sensitivity to light or sound. Is anybody here that feels like they're very sensitive to light? Like, okay, light sensitive, hence the glasses, yeah, okay. That's a sign of an increased sympathetic tone. You may have cold hands and feet, frequent urination, erectile dysfunction, low sex drive. Now, what causes brain degeneration? So this is a really important slide. There's about 11 things. Blood sugar imbalances can cause it, stress, there's different kinds of stress, poor circulation, food sensitivities, poor gut function, overall inflammation, poor neurotransmitter function, hormone imbalances, poor essential fatty acid, toxins can do it, and also a lack of activity. So we're going to talk about each one of these. So number one is going to be blood sugar. Now, it's important to remember is that you can't separate the health of your brain from the rest of your body. It's all connected. Okay, blood sugar imbalances. Blood sugar can be high blood sugar, low blood sugar. And unfortunately, high blood sugar is kind of an epidemic in our country. More and more people are getting that. So if you're diabetic, that would be your blood sugar, fasting blood sugar would be 126 or higher. If you are pre-diabetic, that would be blood sugar above 99. So pre-diabetes is basically you're heading that way. Both of those are inflammatory. So when you have high blood sugar, some interesting things happen to a lot of things change in the body, but one of the things that happens is it changes your neurotransmitter function. When you have high blood sugar, you have high insulin, which is inflammatory, and what that does is it causes elevated tryptophan and tyrosine, which are amino acids that you get from digesting your food, and those are the precursors, along with certain vitamins, that make serotonin and dopamine. Raise your hand if you've heard the term serotonin or dopamine, okay? And those neurotransmitters are important for energy level and also feeling the pleasure reward phenomenon, like getting enjoyment out of your life. You do something, something good happens, and you feel happy about it. It's really important that work well. And so what happens is when the blood sugar is high, we have too much of that serotonin dopamine, and the receptor sites downregulate. So even though there's too much there over a period of time, those receptors don't respond to the neurotransmitters, and we get low energy, fatigue, and that lack of that pleasure reward phenomena that we need to experience. Now, here's a real important thing, is that symptoms of chronically high hormones or high neurotransmitters are going to give ultimately low levels of function. Okay, so if it's too low, you're not going to have enough, but if it's too high, the receptors will stop paying attention, they'll start ignoring the stimulus, and you're going to get low function. It's important to know that. Now, with low blood sugar, low insulin levels, you don't have enough of that tryptophan, you get less serotonin, of course you're going to get fatigue and lack of pleasure. Now, here's something that would be a good clinical tidbit that I think that could be helpful for you. What is the first sign that your blood sugar is dropping? What do you think it is? Pardon me?
Fatigue.
Fatigue, okay. That's good. Could it be more specific? Okay, anybody else have any ideas? Okay, those are all good. The first symptom of low blood sugar is going to feel like your brain went offline. Maybe doing something that's highly cognitive. Yeah, highly cognitive. All of a sudden, your brain is like slow, or you just feel like you can't concentrate. That's the first sign that your blood sugar is dropping. It's not going to be that you're hungry. It's probably not going to be fatigue. It's going to feel like maybe it feels like brain fatigue. So that's the signal to eat something. I think if you do that, you'll find within like 10 minutes you're like back to work. So it's important to keep your blood sugar real even throughout the day, because that's the fuel to the brain, right, along with oxygen. Okay, I think that'll be helpful for you. Number two, stress in the brain. Stress, and there's lots of different kinds of stress, causes brain atrophy, promotes inflammation in the brain, and it breaks down the blood-brain barrier. How many have heard of the blood-brain barrier? Okay, good, a lot of educated people here, that's great. So the brain has a barrier called the blood-brain barrier that doesn't allow certain things to pass through that could be inflammatory for the brain. And what happens is, and we'll talk about more things that cause stress to the body, it breaks that down and things can get into the brain to cause inflammation that shouldn't be there. So the biggest stress is typically not emotional. One big stress is having a poor diet, a diet with too high in carbohydrates, trans fatty acids, a lot of sugar in our American diet, unfortunately. Alcohol is a stress to the brain, smoking, excessive caffeine, food sensitivities, and if you're anemic, you're not getting enough oxygen to the brain. The blood flow might be okay, but if you're anemic, you're not getting oxygen because the red blood cell carries oxygen. It's got to get to the brain. Gut infections create inflammation. Autoimmune disorders, I see a lot of autoimmune patients. I see a lot of Hashimoto's patients. Musculoskeletal pain, if it's chronic, shows decreased activity in the brain if it goes on for a long period of time. Also, if you're not digesting and breaking down your foods, you don't have those amino acids to make neurotransmitters. Now, degeneration of the hippocampus occurs when we have high levels of cortisol. Cortisol is something that helps balance blood sugar. If the cortisol level is in a good shape, we're doing good. But if it gets too high, that actually causes inflammation in your hippocampus, which again is involved with memory. So anybody who has dementia, that's something to get checked out to see if that inflammation is causing challenges with temporal lobe. High cortisol also inhibits the pituitary gland, which is part of your endocrine system, which is going to cause poor thyroid function. It also promotes weight gain. We have people coming for weight loss. This is something that we check to see if they have high cortisol because it promotes weight gain. So because the adrenal gland and cortisol is so important, we do something called an adrenal saliva test on most of our patients. Anybody had this test done before? Adrenal saliva? Okay, a few people. So what we do is we give the test kit, the patients take it at home, and what they do is they take a sample as soon as they get up, one at lunchtime, one afternoon, and one right before they go to bed. And it creates a graph. As you can see on this test here, is that the areas that are red, that's where the cortisol should be. As you can see on the white here, this is where some readings were on a patient that we did the test on. Do you see how the white is below the red there? That's low cortisol. That person would typically feel pretty tired. They would have a hard time getting out of bed. They feel, I'm not a morning person. That's low cortisol. As the day goes on, the cortisol raises, but at night, it should be low. Cortisol is stimulatory. When you get up in the morning, you should be ready to go. And at night, you're ready to relax, right? So in this patient, the cortisol level was high because it's stimulatory. Guess what? Can't get to sleep. Toss and turn. So that's something that's important to check out. So if cortisol is off, it promotes blood sugar balance, so we got to check your blood sugar. Any type of chronic pain or inflammation is also going to elevate cortisol. Chronic infection can do that as well. Number 3 cause is going to be poor circulation. We got to have blood flow along with enough oxygen on the red blood cell, and the nutrients got to get to the brain cells to keep them healthy. Brain consumes 30% of all oxygen intake. If the brain is deprived for more than 5 minutes of oxygen, it could cause permanent damage. So here's some symptoms of low blood flow to the brain. You've got low brain endurance, focus is poor, concentration. You feel like you have to exercise, drink coffee, or do something else to get your brain going. It would also promote cold hands and feet because of circulation. Your nails may have fungal overgrowth on your toes or your hands. Your nail beds, instead of being nice and pink, they may be more white. You also may notice cold feeling on the tip of the nose. Now, if we have poor circulation in the brain, there's different things that can cause that. Okay, stress. When you have stress, most of the blood's going to be concentrated to the heart and the extremities. It's going to go away from the brain. If you're anemic, smoking, low blood pressure, not enough pressure to keep the blood flowing into the brain, or if you have high blood pressure, that creates damage in the capillaries so it can't get through the damage. Diabetes, poor cardiovascular function can all cause circulation issues. Now, fortunately, there are some botanicals that people can take to help improve the blood flow to the brain. Feverfew extract, ginkgo biloba, a product called Hyberzyme, and a product called vinopocetine can all be helpful. There's some products that we have in the office. We have this one product that has a lot of these things in it called NeuroO2. There's another product that we have called Nitric Balance that can improve blood flow. So there's some things that can be done to improve that. We also have a device that we use in the office called the Nano V Pro, and what it does is it helps you utilize the oxygen that you're breathing more efficiently. When you breathe oxygen, it creates what are called free radicals. Raise your hand if you've heard of free radicals. Okay, it's just something normally that happens. And so this device, as you breathe the stream of air, what it does is it helps you dampen those free radicals, and it actually helps stimulate a healing response in the body. We just had a patient who came in last week, had like an IBS, Hashimoto's. She also has lots of dizziness, and we were done with our exam. We put her on in front of that machine, and she had a lot of dizziness just in the office, and we put her on the machine for, and like maybe within like a minute, she said, I don't have any more dizziness, just sitting there. So it's a really good healing tool. Most of our chronic patients utilize that therapy. It's very, very powerful. Okay, number 4 thing that can cause brain degeneration are food sensitivities. So you get a food sensitivity, most of them are going to be acquired because of inflammation in your gut. If inflammation in your gut, and what happens is that you get what's called the leaky gut. Raise your hand if you've heard of leaky gut. All right, so what happens is you have these tight membranes. You typically get a gut infection or something else that creates inflammation, and these tight junctions that only allow fully digested proteins to get into the membranes, which are going to get into the bloodstream, into the cells. What happens is that because of inflammation, it does this, and then undigested proteins leak in here, and the immune system is right here and it says, I've never seen this before, this must be something bad, so it attacks it, creates inflammation, and what happens, it also puts a tag on that food particle, and it basically says, next time I see that, I'm going to pounce on that. So you start developing food allergies and more food allergies and more food allergies. So that's an important thing. Now, when you have those immune reactions, it creates something called cytokines, which are just immune cells, and what they do is they can actually get through the blood-brain barrier. So if you start with inflammation in your gut, it can cross that protective membrane and get into the brain, and you got brain inflammation. So if you got brain fog, you must have brain inflammation. Mm-hmm. A viral infection can cause cell damage, yeah, cell damage.
Is that?
It could be in the gut, yeah, yeah. Well, dementia is going to be, loss of memory. It can be caused by many different things, but poor gut function could be a precursor, yes, to dementia, because it's going to, and that could also raise cortisol, which the hippocampus and the temporal lobe doesn't like that. So yes, it could be related. Now, most common food sensitivities are going to be gluten, dairy, probably 1 and 2, eggs, soy nightshades. How many people know that you have some food sensitivities? So a lot of people know that they do, but also a lot of times that people actually have food sensitivities that they don't know about. And that's why we do a test called Food Test 95. It's a blood-based test. It checks 95 foods. And what we found out from doing this test that a lot of people had sensitivities to things that I would have not thought people would have been sensitive to. A lot of people show up with challenges with garlic and pineapple. So this, yeah, so that's kind of interesting. So this is a test we do on a lot of patients. Here's the actual test that shows what showed up. As you can see, I circled some things like dairy, eggs, gluten, wheat, and sunflower seeds. So that's an important test that we do in a lot of patients. What is irritable bowel? Irritable. Okay, you know what it is. Irritable bowel is you're reacting to things. You've got a gut inflammation. You're probably reacting to foods. If someone has irritable bowel, that would be a good test to have, along with some other things that we need to do. But they would definitely want to. Yeah, find out what you're sensitive to. Take it off take you off that reactive food for several months. Treat the gut infection. Look what the whole body. Look what we need to do, and then over time, see if a person can reintroduce that without reaction. A lot of times that can be successful. Sometimes there's certain foods that people are just going to have to stay off of. All right, so poor gut function is going to be our 5th reason the brain degenerates. We already talked about how when you have bad gut, you can get bad brain, but also if you have bad brain, you develop bad gut. Well, why is that? It's because of brainstem. What does the brain do? It drives the organs, right? So if we have bad brain function, we're going to have challenges with our gut. Your vagus nerve, which is the biggest nerve in the body, comes out of the back of the brain, helps you make hydrochloric acid. You got to have hydrochloric acid to digest food. Hydrochloric acid is also a protection against infection. It's so acidic that it's going to kill 99% of all pathogens. But many people have low hydrochloric acid production, and so they're opened up for getting infection. So there are some neurological therapies that we do to help the the brainstem and the vagus nerve to work better, there's a membrane called the meninges or the dura, same term, same structure, and it wraps around the brain, attaches the brain to the skull. It also wraps around the cranial nerves and goes all the way down the spinal cord and attaches on your tailbone. And that membrane can be torqued or twisted, and if it is, that vagus nerve and some of the other cranial nerves won't be able to send the appropriate message. It won't be a full message, and as a result of that, you'll get sluggishness in your organ systems. Decreased hydrochloric acid, decreased gut motility, can cause issues with digestive function from a neurological. So most of our patients, we always test for it, but we do what are called cranial adjustments, which are light. We put the position in the neck and the skull in a certain position, and it's a delicate way of detorquing the dura or the nervous system or the meninges. So that's an important therapy that we do. So some causes of poor gut function. We've already talked a little bit about some of these things. We talked about the food sensitivities, the leaky gut, gut infections. You know, your diet is poor. So you got to get tested for these things to see what's going on. So we have these really vicious cycles of we have brain problems, we have gut problems, which feedbacks into brain problems. So we've got to work on both sides of the equation to get these things to resolve. So we've already talked about some of the causes of brain inflammation, diabetes, high carb diet, inflammation, poor circulation, high cortisol. We talked about a lot of this. Now, neurotransmitter function. Neurotransmitters are basically chemical messengers that carry chemical messages between the neurons in the brain. There's an electrical signal too, but there's also a biochemical signal. And when there's a biochemical signal, we have to have certain nutrients, we got to have amino acids, we got to have iron and different B vitamins to make that work. Now, for people who are taking medications to modulate this, what can happen is just like when the blood sugar's high, what happens is those receptors will downregulate, and over a period of time, the drugs that you're taking can become less effective. So let's talk about some of the different neurotransmitters. Acetylcholine. It's very good for memory comprehension. Acetylcholine might be something that you take if you have to study something that's maybe you're cramming for a test or something. You really have to concentrate. Acetylcholine supplementation could be good to help your brain work better. Serotonin, we already talked about that. It's involved with enjoyment, satisfaction. It's involved with sleep. You've probably heard of melatonin. Serotonin is the precursor to melatonin. Dopamine is involved with motivation, social activity, feeling good about yourself. GABA is involved with the calm anti-anxiety, dampen worrying. The first three neurotransmitters are all stimulatory. The last one, GABA, is inhibitory. So if we have all stimulation and no inhibition, that's not good. The key is we got to have balance. There's a survey that we have in the office that we have people fill out that can give us ideas if there are some weaknesses in these different neurotransmitters. Now, we don't just take that information, give somebody neurotransmitter support, because we got to look at everything else that's more important as far as priorities. We got to look at gut function, inflammation, work on that first. But sometimes we do give people things to help. Probably GABA is probably the most common thing that I give. Nutrients to help you make more GABA. So what can cause neurotransmitter imbalances? Well, medications, we talked about that. Gut inflammation, vitamin deficiencies, anemia, food sensitivity. If you have autoimmune issues, sometimes the immune system can attack different body parts. It can attack the neurotransmitter. There's a autoimmune condition that does that. Also can attack different organs. Thyroid, that's Hashimoto's. It can also be affected by hormone imbalances, which you're going to see here in a minute, leaky gut, overall inflammation. So number 8 thing that causes the brain to degenerate is hormone imbalance. Thyroid hormones impact all the neurotransmitters. That's why a lot of people who have low thyroid and or Hashimoto's may notice depression. It affects all neurotransmitters, so it's really important that you optimize your thyroid function. Testosterone affects dopamine and acetylcholine in men. Progesterone impacts GABA receptors in men and women. Estrogen impacts serotonin receptors in men and women, and estrogen also impacts dopamine and acetylcholine receptors in women. So all the hormones need a very special substance to actually be produced. That's cholesterol. Okay, we hear about cholesterol a lot, right? And unfortunately, through advertising and big pharma, there's a lot of information out on the advertisements about, taking things to lower your cholesterol. Well, you got to have enough cholesterol to actually make hormones. So that could be a problem. If the cholesterol is too low, you won't be able to make hormones. Recent research shows that as long as your inflammation is down, even if your cholesterol is up, that it's not a risk factor for heart disease. When people have heart disease, the doctors are concerned that the cholesterol, if it's high, can actually start depositing in the arteries. Well, it won't do that unless there's inflammation. It will actually start sticking to your arteries, which can cause the lumen to decrease, but that's a problem. But if your inflammation is low, it's not a problem. If you are on statin drugs, you should definitely consider taking coenzyme Q, which is a nutrient that is blocked by the statin drug, and it's important for making energy in your cell. Okay, number 9, proper essential fatty acids. You probably didn't know this, but 60% of your brain is fat. Vegetable oils, hydrogenated oils, cause the membranes and the brain to become unresponsive. Omega-3s and omega-6s help reduce inflammation. In our office, we probably give a lot more supplements for omega-3 because a lot of people have nuts in their diet. Animal products also have omega-6s, so tend to supplement more with omega-3s. How many of you have heard of a omega-3 called DHA? Okay, that's a real good thing for brain. That's something that we often recommend to supplement. And the good thing is that because we live here in the Northwest is that we have readily fresh seafood, which is good. Salmon is a very good thing because it has those healthy omega-3s in it. A good target for a lot of people would be to take about 5,000 milligrams of essential fatty acids. Either you're getting it through your diet by eating fish or through supplementation. Okay, our number 10 reason your brain degenerates is toxins. We know that there's a lot more toxins in our environment than there were years ago. Unfortunately, many people are on prescription drugs. Prescription drugs always have side effects to them. And even if you aren't taking drugs, you can actually be getting drug residues in your tap water. Okay, our municipal systems, they clear bacteria and things like that, but it's been shown when testing's done is that they don't get rid of the medications. When people use the toilet or flush things down the sink, those things get into our water system. So you should definitely be drinking filtered water because you get drug residues in your body without even taking medication. So with all this toxicity in our environment, what do we do to be able to detox better? Well, filtered waters are a very important start. We got to have a properly functioning immune system. We also need to have a good liver. Your liver detoxifies your body. I would say that's one of the most important interventions and most common things that we do in the office is put people on products to help your liver work better. The liver has a lot of jobs to do, detoxifies the body. It's been estimated that 2/3 of toxins could be avoided if you would just eat organic food. Organic food is more expensive, but it's really worth it because it has higher nutrient levels than commercially grown, and it doesn't have the pesticides and the toxins in it, so it's definitely worth doing. Our number 11 reason the brain degenerates is not enough activation. Your brain is a sensory, big sensory receptor. Your eyes take in information, what you hear, taste, smell. Moving your joints under the effect of gravity, all those things activate the brain. Does anybody know what the 2 biggest brain inputs are? What are the 2 biggest brain inputs? Any ideas on that?
Besides breathing?
Besides breathing? Okay. All right, here you go. Gravity, joint movement. If your joints need to move, and if you have joint movement against gravity, it's one of the major stimulators of brain. Also, yeah, so exercise is good, yeah. Touch, those 2 are the biggest activators of the brain. So some conventional brain-based therapies would be like counseling on the emotional side of the brain, very good. Exercise is great. Music, being involved in a hobby, making sure you get adequate rest, because at night your brain rejuvenates, your body rejuvenates itself. So some more advanced and specific brain-based therapies would be something like eye movements. When you move your eyes up and to the left and down and to the right, you're activating your left cerebellum. Remember, the cerebellum, back part of the brain, controls balance, coordinated movements, tone of the spinal muscles. If you move your eyes slowly to the right, you're activating your right parietal lobe. That's your sensory part of your function. If you move your eyes quickly back to midline, you're activating your right parietal lobe, or right frontal lobe. That's focus, motor activity. So we can, based on our examinations, we can do different therapies to activate those different parts of the brain. We do them in the office. We give patients exercises to do at home as well. Vibration therapy is a great therapy. Something called a nonlinear complex hand movement. That'd be like this, moving your arm. When you do this, you're activating your right cerebellum. Yep, you can do it with your leg too. Balance on one foot. It's a little bit harder to do. You're activating your right cerebellum and your left frontal lobe. Now, we could add something to that, and we could have a person change the inflection of when they move their arm based on a rhythm. We set up a metronome. Every time the metronome click, 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 that would activate the brain on another level. So there's lots of different things that we can do. Balance exercises.
Ultrasound, a treatment that
No.
fit in here?
No. Ultrasound would be like diagnostic. You can also use ultrasound for like a heat therapy, and there would be some stimulation.
I thought it helped clean debris.
Now it basically it heats the tissue. So heat
Ultrasound.
does stimulate brain. So there's some effect. We don't use ultrasound though for any brain therapies. Ultrasound can also be diagnostic. Just to like see things in the body, like diagnostic ultrasound. Yeah, okay. Spinal adjustments can be a very powerful therapy for brain, because one of the main inputs to your brain is joint movement. If we have joints that are out of place, locked up and not moving, you lose brain stimulation. Yoga is great, massage, there's lots of acupuncture, it's all a lot of good stuff out there. Okay, so as a review, what do you need for a healthy brain? Fuel. Oxygen, glucose, right? You got to have proper neurotransmitter function, proper activation. You got to have an inflammatory-free environment. And if you don't have these things, and even if you're taking medication, it's not going to work for the brain in the long run. Now, you may have been told that your lab tests are normal. I get this all the time. Patients come in, they have chronic conditions, they go to the doctor, they run a few tests, comes back, everything is normal. Patient gets really frustrated because they know they don't feel normal, but yet the doctor says, well, you're normal. So let's talk about that. It's very important. Here's the thing to realize is that traditional lab ranges are inaccurate because they often don't find things that are functionally off, but not to the point of a pathology. And also what's interesting to know is that how they come up with these ranges in traditional medical care is based on everybody who goes to the lab last year, and they just average it all together. So you get a bell curve. So if you're really on the extreme ends of things, then that's going to be valid. But a lot of people are going to be in these green areas where they're not extremely high or extremely low, but in these green areas, there's a functional loss there. And they don't look at that, and they tell the patient that they're normal when they definitely have a functional problem. So here's how this would actually work out in a real-life situation. Patient comes to my office, thinks she might have a thyroid problem because she has every thyroid symptom: fatigue, hair loss, dry skin, depression, constipation, can't lose weight, even on a low-calorie diet. Goes to the doctor, they typically only run one test, TSH, comes back, medical doctor looks at it and says, okay, you're at 4.2, but my range that I go by is 0.3 to 5.7. Normal. Patient gets really frustrated, doesn't know what to do. Comes to my office, we evaluate and say, look, well, based on the functional range, you should be closer to 1.4. You have functional hypothyroidism. We put that person on a program, we do all the tests, get the thyroid working better, patient's able to lose weight, doesn't have to wear a sweater in the middle of the summer. Finally loses weight. We had one patient who actually hired a personal trainer because she couldn't lose any weight, and worked out for like 4 days a week for 6 months and not lose 1 pound. And she was actually a nurse. And And of course, she went the traditional route and said, your thyroid is fine, but she had every thyroid symptom. She came to see me. We put her on a program to address what we found. Lost weight, didn't have to wear a coat in the middle of the summer, and also was able to come home from work and not just like crash on the couch. She had energy for the rest of the day. We found the cause. Now, when patients come to us, it's usually always a combination of neurological issues and metabolic. So when patients come in, we got to do our comprehensive workup. We got to look at the metabolic side. We got to check things like blood sugar, adrenal function, thyroid hormones, reproductive hormones. We got to look at your digestive system. May have to look at your immune system if you're autoimmune, and also look for other sources of inflammation like food sensitivities. On the neurological side, we got to test your whole nervous system. We got to test the lobes of the brain. We got to test your spinal alignment, your spinal cord function, and also your peripheral nerves. So we do a very thorough evaluation to look at your whole nervous system. Now, what I'm going to do is I'm actually going to show you some of the tests that we do. And I think this will be kind of a fun thing, and we'll actually do so the tests that we'll do will be very non-invasive, and the treatment that we do will be very non-invasive as well. So as a means of helping you see what we do and how things can change pretty rapidly neurologically, I would like to have a volunteer. A volunteer would be somebody maybe who has balance challenges, maybe you've got neck issues, maybe you've got challenges with your shoulder. Is there anybody here that might be willing to volunteer to do it? Do you look like you might be? Would you? No? Wait, we need a volunteer. We've got to have somebody, okay? Okay, all right, very good. Come up here. All right, if you could just slip your shoes off for a minute, that'd be great. And what is your name?
Rose.
Okay, Rose. All right, Rose. Rose, if you could come over here, that would be great. And what we're going to do is we're going to move one of these chairs here. Okay, Rose. All right, very good.
I have good balance, but I have neck problems.
Okay, all right. So here's what we're going to do. What I want you to do, Rose, is face this way, feet together as close as you can. Okay, good. Now what I want you to do is just close your eyes. And when she closes her eyes, we shouldn't see too much movement. And we don't see too much movement there, but turn your head to the left. Your eyes are still closed. Let's see if we have any challenges there. Okay, all right. That's not too bad. Can you go to the right for me? Just with your neck, just turning your neck to the right. Okay. Okay. Now, did you feel how wobbly? She got super wobbly when she did that. Do you see that?
Yeah.
She got very wobbly. That shouldn't happen. It didn't happen when she turned your head to the left. Why would it happen when she turns her head to the right? There's something functionally not going well there. Okay, very good. Now, eyes open for me? Okay, very good. Now, the next test we're going to do is, Rose, I'm going to have you have your hands out like this, and what you're going to do is you're going to close your eyes and you're going to touch your nose right to the tip of the nose. So it's right to the tip. Okay? So let's start with this side. Eyes closed, go. See how she missed that? She missed it. Okay, let's do it on this side. Okay, that was a little bit better. Let's do it one more time on this side. So she definitely missed on the left, and when she turns her head to, she's not even sure that knows that she has no idea where it is. So that shouldn't be. So we definitely had trouble with what's called the finger to nose test. We also had trouble when you turned your head to the right. You got very wobbly. Now what we're going to do is we're going to do a muscle test. So here's what I want you to do. Have a seat right here, and what we're going to do is we're going to check some of the muscles in her upper extremity. So we're going to check her right deltoid. Okay, hold this up for me. I'm going to push straight down. Okay, hold strong for me. Good. She has pretty good tone there. Now let's check her anterior deltoid, and that's good. Now let's check her left deltoid. Look straight ahead. I'm going to push. Uh-oh. You feel how weak that is? She can't do it. Okay, she can't do it. Now what we're going to do is we're going to have her turn her head to the right to see if it gets better. When she turns her head to the right, it's stimulating the right cerebellum. Let's see if it gets better. Whoa, it got better. So we stimulated the brain by having her move her head and her eyes. It got better. Turn your head to the left. Does that get any better? That one? No, that one doesn't get better, does it? Okay, so what we're going to do is we're going to do some things. We're going to do some brain-based therapy, and after we're done with her, we're going to retest some of these tests. I think they're going to do quite a bit better, but let's see. Okay, so hold this up for me like this. I'm just going to push straight down here, hold strong. Okay, so what I'm going to do, is we use kinesiology in the office too. What I'm going to do is I'm going to check some areas in her neck. That's pretty good. Okay, so when I touch over her C1 vertebra, her arm goes very weak. So what I'm going to do is I'm going to do some very gentle tapping on the left side of her neck. This is called an arthrostim. Here's what it feels like, Rose. Can you handle that? Okay, so here we go. Okay, so turn your head to the left, and we're just going to tap on this. Good. Okay, very good. Okay, all right. All right, hold this up. Now I'm just going to check a couple other things here. Okay. All right, now. Okay, so what we're going to do is we're going to do some vibration on her right shoulder, which would stimulate her right cerebellum. We determined that her right cerebellum, it's not a disease, but it's not firing at the level that it should. And I'm going to do some vibration on her right shoulder, her trap, while she...
Can I feel the vibration?
Yeah, sure. Can you handle that? Okay, I won't push too hard. And at the same time I do that, we're going to have her move her eyes up and to the right and down to the left. That's going to stimulate her right cerebellum. Just do 10 reps for me, okay? 10. Good? 10? Okay, very good. All right, very good. Okay. All right, hold this arm up. We're going to test some other things. Just hold this arm up. Okay, close your eyes, turn your head right. Good. All right, now what we're going to do is we're going to retest. Okay, go ahead and stand up for me. Okay, face straight ahead. Okay, feet are together. Good. Now turn your head to the right for me. Eyes are closed. Okay. I would say it's a lot better. Do you notice a difference? You're not even moving. Do you notice a difference? It's a lot better, isn't it? Good. All right, very good. Okay, now heads face straight ahead. Let's do our finger to pen test, or finger to nose test. Good. And there. Good. Very good. Pretty good, huh? Okay, now have a seat right here. We're going to check your left deltoid muscle. Okay, hold this up. I'm going to push. Do you notice the difference in the strength? Like you can do it. So we did some things that were seems simple, but it's knowing what to do, right? It's knowing what to do. And right away, her neurology improved. So that's kind of a demonstration of what we do with what we call functional neurology. These things are going to help the brain work better. Of course, we got to look at her metabolism as well, because that's inflammation is going to affect the neurology too. All right, very good.
And I feel super focused.
You feel what?
So focused.
You feel like you can focus better. Awesome. Thanks for sharing that. All right, very good. Okay, did you like that? Was that good? Okay. Seems like magic, but it's not. It's neurology. It's neurology, okay? All right, very good. Okay, now I've got a couple of testimonials that I want to play, and we have one of our patients here who's going to share some information too. So I've got 2 videos that I want to show. The first one's pretty short. Okay, here we are with Crystal. And Crystal, you had a lot of wins in our office with different things that were going on with you. Can you tell us what some of the major issues that you were dealing with when you first came to see our office?
When I first came in, the major ones were I was always tired all the time. I had no idea why, and I would eat and I'd want to fall asleep. So, and other than that too, it was chiropractic adjustments was like my primary reason for coming in. And then discovering that I was tired had a relation to food. And so when you found that out, kind of figuring out all of those pieces that
change your diet,
changing my diet, how to find the foods that I wasn't going to have a reaction to.
Right. Good. And how? And tell me about how your brain was doing prior to being under care.
My brain was kind of like living in a fog. So pretty much it. I'd be fine in the morning if I just had like fruits or what have you, but then by the time lunchtime came and I ate, it felt like my brain just kind of went to live off in the clouds for the rest of the day. Okay. And I would get tired and want to go to sleep. So
it's hard to get things done.
Hard to get stuff done.
Hard to concentrate. Okay. Yeah. So we changed diet. You got a lot better energy. We also had a lot of really bad headaches too, weren't you?
Yeah.
Frequent headaches.
Yeah, because my neck was always out,
Okay.
my back was always out, and every
Okay.
time going to previous chiropractors that had been going for like 5 years, every time I would get an adjustment, it wouldn't stick.
Right.
And every time they would do the same thing over and over again, and they weren't solving the problem.
Right.
And that was really just chronic headaches all the time because my subluxations were never fixed.
Right, right. Okay, and that's done much better under care. So you had better energy level, brain is working better. And how about digestion? Did it also improve?
Yeah, that
Yes.
was a really big thing that
Yes.
when it's been about a year now when I started to think, okay, there's a problem. I came in, started at least getting adjustments, and then discovered that there was the food stuff. And when you took me off all the foods and we did the stomach.
Worked on the digestion.
Yeah, the digestion, like giving me the scoop of the stuff a couple times a day. As soon as I started doing that, my digestion got better. Like I wasn't as sensitive to foods as much, and I didn't have, I started to lose a lot of weight actually, and starting to do that at that point in time from changing my diet, and then also fixing my
Fixing
stomach.
your gastrointestinal system. Okay,
Yeah.
so you had a lot of wins. And overall, how much weight did you lose on our program?
I lost 40 pounds.
40 pounds. Wow, that's amazing. And how long has it been since that weight? So you started losing weight, and you've been able to keep it off for how long now?
I lost weight continuously from, I'd say, this time last year, and I've been able to keep it off ever since.
So it's been like you've lost a lot of weight, 40 pounds, you've been able to keep it off, which is fantastic. I'm curious, if you had not come to our office for care, and you're running a very successful business now, do you think that you would have been able to pull off starting a new business and make it so successful?
Probably not.
Then
No,
I don't think so.
I didn't have the capacity.
You didn't have the energy to do it. Yeah, you didn't have the energy to do that. So would you say that your experience in our office has been life-changing for you?
Yes, it has.
Very good. Thanks for sharing, Crystal. Okay, here we are with Nicole and Evan. And Evan came into our office, was referred by a friend of Nicole's. And Nicole, could you share, previous to Evan being a patient, what was going on with him and why did he come in?
So Evan, it started where one day he said that his legs felt funny, and when he was talking about it, it sounded similar to restless legs. So we figured that we would just kind of wait and watch. We took him to his doctor, and they did. Then his levels were low, but then he started. One day he came in, and his right leg was tremoring, just a fine shake, and it was just going. And then a couple days later, the left leg did it, and then the right leg, or both arms, left and right arms. And when the tremoring stopped, he was left with a tingling sensation, just 24 hours of tingling. Not quite pins and needles, but tingling. So our pediatrician had sent us into a neurologist where they did MRIs and what else did they do? They did EEG, and we had it all done. And he was diagnosed with epilepsy. But we did not feel, and he was put on anti-seizure medication, which we did not agree with because we didn't feel that was it at all. He's passionate about soccer, that's his thing. And when he would pull himself from his game after 5 minutes in tears because his legs hurt so bad, we're like, no. So we kept searching, and we saw 4 different neurologists in the area. Pediatric specialists. We drove down to Olympia to see somebody who was highly recommended, and ultimately they just told us that it was in his head and that there was
no organic cause of it.
There was no cause for it.
But in the history, though, what as far as the history goes, what were the things that were feeding into this problem? He had a history of several.
He's had concussions.
Right. How many concussions? Not including the recent one.
Yeah.
Before he came to me, he had 3 or 4,
he
right?
He had 3 or 4 before this, and all of these we shared all of that with them.
Right.
And but so we were told that there was nothing wrong, and he's actually still on the waiting list. Almost a year later, to get into children's pain management clinic, and they told us that he'd have to talk with psychiatrists, and we're like, yeah, that's not it. So he went in and he was in the hospital for 4 days to do a video EEG.
Mm-hmm.
And the night before we went in, I was talking to one of my friends, who she said, well, nerves, I've got the doctor for you.
Yeah.
And I said, hey, we will do anything, huh?
Right.
So we came and
Had an evaluation.
Had an evaluation.
And with all that testing that you did, they basically didn't find anything. How much do you think that all that testing cost? Would you say?
Oh, thousands and thousands and thousands of dollars. I mean, with the MRIs and the EEGs. I mean,
How much do you think we're up to? 20,
oh,
$30,000?
$40,000
$30,000 with basically
Mhm.
no reasonable explanation of why we're having the symptoms that we were. Okay.
$30,000 to $40,000 plus anti-seizure meds.
Right, and also there was some history of some ADHD as well, right? So
Mhm.
you came into the office, we did a real thorough evaluation. We looked at how the brain was functioning. We also looked at his overall metabolic makeup. We put him on a protocol to address his metabolic issues that we found based on laboratory testing that we did. Also neurological therapy, what we call brain-based therapy, to help his brain work better and to reduce inflammation from all the trauma that he had to the brain. And as a result of those therapies, what has changed?
Everything.
Everything has changed.
Yes.
And prior to you getting care, when there was no solution, what was that doing to you feeling positive about life, Evan?
Well, I felt kind of depressed.
You felt
because,
depressed,
like,
right? And one thing we didn't mention, you had a constant headache, everyday headache.
Mm-hmm. Mm-hmm.
It's terrible for anyone to have a headache every day, but someone so young to have a headache every day, it's awful.
And he had had an amazing attitude throughout all of it.
Right.
You know, he's
Mhm.
just like, but after months, I mean, this went on for 7-8 months that
Yeah.
we were dealing with
Trying
this.
to find a solution,
And towards
right?
the end, then you just saw it. You saw the smile was gone, and he was
Yeah.
getting sad, and he's like,
Yeah.
"Am I going to have this forever?" I was
Right,
like, "No, we're
exactly.
going to keep going."
Yeah.
And so when we came in for that first evaluation with you,
Mm-hmm.
I was ecstatic. I think we
Mhm.
both were. We were both fascinating. So he's had experience with vision therapy and brain-based training,
Mhm.
which we saw incredible improvements in numbers and whatnot.
As far as maybe cognitive ability, but not
Cognitive
necessarily
abilities.
symptoms as pain and
Exactly. No,
and
it was
function. As far as
definitely-
body function, no change there, but there were some improvements in scoring and things like that, cognitive wise.
Exactly, exactly.
Right.
And but for that evaluation, we were both just blown away by it. It was the most thorough evaluation, and it was
Right.
fascinating. As you
Yeah.
know, I was taking notes and asking questions,
Right.
and
Right.
it was crazy. And you told us that day that we've got this,
Yeah,
and
it's
sure
going to
enough.
get better.
And so he was having, so the tingling sensation was constant, and he was having tremors, whether it was in a leg and an arm, both legs, both arms, 4, 5, 6 times a day for 7 months. And after first visit with you, he has not had a single tremor
Yeah, that's amazing.
since then, not a single tremor.
Right.
And then a few weeks after we started seeing you, Sweet Child got another concussion,
Yes,
which ended up
which
being
is-
a blessing in disguise because, as you said, we realized then that through treating that, that it was more neurological maybe than we had originally thought, because we saw such improvements. And so then what you learned from that, you were able to focus on, and then the tingling went. And I'll never forget.
Right.
I
And
don't
the
think you
daily
will.
headaches, too.
And the daily headaches, those all ended. And
yeah.
I won't forget going out into the car that first time that, there was this major adjustment. And he was mad because he said, I went from that tingling from a 7 and an 8 to a 2 in one day.
Yeah.
Why did those other doctors take so many months and tell me nothing was wrong? And that
Right.
was a huge
Yeah.
moment for us, wasn't it?
Big wins, yeah.
Mhm.
So we had major reductions in all the symptoms, improvement in some ADD tendencies as well.
He is off his medication since we started seeing you, and
yeah.
his teacher,
Right.
my husband and I, we all, and Evan himself said to me one night, all within like a week, he said, I feel like a different person. And
Yeah.
his teacher, and I wrote her a note
Yeah.
and said, did you get on his case about this? She's like, no, I just assumed he had a big talking to at home.
Yeah.
So,
And so the results have been so good that now, Nicole, you're under care as
I am.
well. And also your dad, Stephen, is under care as well.
We're all here.
And there's also some similar issues with some ADD issues and some chronic pain. And you guys are progressing as well. And
Inflammation and autoimmune and
yeah.
thyroid and all
Yeah,
that good
that's
stuff.
all that good
and
stuff.
It's been wonderful.
Great. Well, Nicole, if you knew somebody who had a chronic condition and wasn't seeing results, would you refer them to our office?
I refer people daily to you.
Okay, I appreciate that. Great. Such a great story. I'm so happy that we got this on video. Thanks so much.
Yeah, thank you.
Thanks for being here. Our lecture's just about over here. And in the first lecture, I talked about a gift that I have for everyone. And that gift is because you've been a good audience here and you've given me some of your time and let me to educate you, I'm going to let you come into my office for a neurometabolic evaluation. And then that evaluation, what we're going to do is we're going to go over the paperwork that you fill out. We're going to go over your health history. We're going to do a very detailed neurological exam. We're also going to be recommending different tests that we need to do to kind of get the big picture about what's going on. Normally that first visit's $350 in my office. I spend an hour with you, but because you came to the workshop, it's just going to be $49. And so that's a tremendous value. You really should take advantage of that. So a couple of take-home messages. If you have insurance, insurance will contribute to the care of my office, but there's a lot of it's not going to cover. So what I want everybody to do, just for a minute here, a few seconds, close your eyes. Everybody close your eyes. And I want you to think of one thing that you need to do to get healthier. Just one thing. Okay, got it? Okay, open your eyes. Now by a show of hands, how many came up with what you need to do to get healthier is take more medication? Did anybody put that on their list? Nobody. Nobody did that, right? Get the care that you need with our flexible payment options. You really only have so much more time in your life. And if you're not feeling well now, is this the way that you want to be for the rest of the time that you have left? I hope the answer is no. If you're motivated, we would love the opportunity to help you. 4 reasons why you should accept this gift. Health problems get worse over time if not corrected, so don't wait. You'll be happier and healthier if you correct those health issues. If I can help you, I'm going to tell you. If I can't, I'll tell you that, and I'll try to find someone else who can. I don't want to waste your time and your money. So there's absolutely no reason not to come into the office because you've already spent this time with me. It's just going to be $49. So if you want to come in, on your survey, check the box that you want to come in and talk to Janice in the back, and she'll make an appointment with you. I really appreciated your attendance here. You guys were a great audience. I think you learned something. We had some fun too. So I'll be here to answer any questions after our meeting here. So thanks for coming, and I really enjoyed it. Thank you so much.